Well, this week the Australians Health Team is bringing you a special series on the transformation in our primary care system. The government has put a huge focus on this sector, pouring money into bulk billing and setting up a network of urgent care centres right around the country. This is effectively a third tier of our healthcare system, straddling primary care and emergency departments, and they're almost rolled out all around the country with 124 clinics now open out of a target for the Labor Party of 137. They're treating anything from burns to broken bones to unexplained fever and rashes, but they've been criticised as being quite expensive.
My name's Brett Kensett-Smith. I was riding my bike on a wet road. The bike slipped from under me and I landed on the road quite heavily. So I'd hit my hip and my chest and my shoulder and my head. So I was a little dazed from the hit, from falling on the road. So I knew I needed to get my ribs and my head checked. I saw the doctor quite quickly, and he was very thorough in his assessment. He worked out that I needed chest x-rays. So luckily in the same building, they also have x-ray facilities. So I had my chest x-rayed and I was back seeing the doctor within 15-20 minutes. So it's all very fast.
Patients come in and usually they've actually been to the emergency department prior. About 40% of our patients already have been to ED, and so they re-present to us because of long wait times in ED, and we can manage their presentations clinically. It's usually things like lacs, breaks, minor injuries, typically urgent care, not emergency medicine. It's a very positive experience. So they get triaged on arrival. We have a benchmark of being seen within 15 minutes. And then after that, there's some interventions and primary assessments before seeing our doctors. And then after that, care based on presentation after that. And we see that typically patients are in and out of a clinic in under an hour.
Last night I was cooking dinner, got out my chopping board, which is one of those lovely, very thick wooden chopping boards, 40 centimetre, dropped it on my big toe. Didn't tickle. Bruised quite quickly, very swollen. This morning it was very painful. Knew I needed to go for help. Decided Chatswood was probably easier than the hospital. Came here this morning, 8 o'clock. There was only a few people here. It was great. Came in, sat downstairs for an x-ray, back up, got my report and went home. I think it's great. If more people knew about it, that would be really, really good.
9 out of every 10 patients that come in would highly recommend the service. It's an advocacy level that you don't see in healthcare very much. It's open after hours, so generally most of them are 14 hours a day. There's imaging on site, there's pharmacy on site, there's pathology on site, and it's all within arm's reach, and so it's going very well. Any change in healthcare generally receives a lot of debate. And this is a pretty major change. It's a third tier of our healthcare system. And I think what I do know is that whenever I invite someone into the centre, whenever they look at it and they're part of it and they see it and understand it and they've worked in it, they become advocates very, very quickly. And I think it's really important to note that every other comparable system around the world has this service.
I've been a GP for more years than I've been an urgent care doctor. When I'm working in general practice, I might see 4 patients an hour, but I share my nurse among my colleagues. With urgent care, the average, I think, across our organisation is 3.2 patients per hour, and I have 1 doctor, 1 nurse, 1 receptionist. So, it's slightly different than GPs. Obviously, it costs a lot more to have 1 doctor, 1 nurse. The consumables is a whole bunch more expensive. So we're giving out moon boots, which in the past have cost $150. We're rehydrating people. So you come in with your migraine or your morning sickness or your gastroenteritis or God forbid your hangover, and we're putting out we're dripping and we're rehydrating you over 2 hours so that you don't have to go to hospital. Sometimes we put in intravenous antibiotics. Again, it keeps you out of hospital. I've gone and bought a point of care ultrasound. So it hooks up to my cell phone. I can look at kidney stones and gallstones, pneumonias. I can diagnose fractures using that. These are things that urgent care does that I wasn't doing in general practice. And yes, it does cost a lot more, but it's a fraction of the cost of the emergency department.
If I did compare them to a standard consult and I considered all the loadings for after hours, for bulk billing incentives, for procedural, for the consumables, they are still a little bit more than a general practice consult, but not that much more. The most important thing is that they are significantly less than an ED consult at about $616 a visit. And so when you consider that half of them would not have gone to an ED, half of them may have been treated in a general practice setting, then they're actually significantly lower from a taxpayer's perspective of that blended average. So overall, I think that they're lower than an alternative.